On the Vaccine Watch tonight, the FDA gave its emergency use authorization for the Pfizer COVID vaccine to be used for children 5 and 11 last week, but there are still several steps before the vaccine can actually be made available to children in Oregon and across the country. To get a better idea of what that timeline looks like locally, let's speak with Valerie Lane now of the Klamath County Public Health. Thanks for being here very much.
Thank you.
So tell us a little bit about where you guys stand in terms of getting the vaccine and waiting for the final steps from the CDC.
So it's my understanding that we actually have vaccine for our children in the state of Oregon, and that will be funneling through to Southern Oregon throughout this week. Tomorrow, the CDC meets to have conversation about the use for 5 to 11-year-olds. And once that's approved, then the Western Coalition will get together and discuss that. And it should hit Governor Brown's desk on Thursday for signature, which means that children could start getting vaccination for COVID-19 as early as Friday. But we think that looking to Monday is probably a better timeline.
What kind of infrastructure will you have set up, or do you have set up to make sure that A, the correct dose is given to those kids, and what kind of demand you think there might be?
We know that there have been families waiting for this since last spring. So this is going to be a relief to many of them to be able to have that done. We know that the way that these vials are now indicated by colors is going to make it easier for whether it's a pharmacist or a medical person to come in and give that shot. One color indicates child, another indicates adult. It'll be a smaller dose for children, so they'll get their first dose and then wait 3 weeks and get that second dose. A majority of our pharmacies are on board along with clinics to be able to administer those. So we think that it's going to go really smoothly.
For a parent wondering where they can get those vaccines, do you expect there to be mass vaccination clinics like we had before, or will it be more individual with doctors and, as you said, pharmacies involved in that process?
I don't anticipate in Klamath County for there to be a mass vaccination opportunity for children. I believe that most of our pediatricians and primary care providers will be doing that in their clinic settings. I know some of our pharmacies have already said that they will help the 5 to 11 group. And there's one in particular I know that said that 7 and older are the ones that they're comfortable administering to.
Valerie Lane, Klamath County Public Information Officer, as always, we appreciate your time and your expertise. Thank you very much for being with us today.
Thank you. Have a good evening.